No, getting invited for a colonoscopy does not mean that you have bowel cancer, but is the best way to pick it up if you do. The chance that we find bowel cancer in those who test positive is 5% or 1 in 20. If you spin this round, there remains a 95% chance that you do not have bowel cancer. If you are in that 5%, it's a worry and it's the start of a journey, but it's absolutely the best way to have it detected because outcomes are much better in screen-detected patients where the illness is picked up at an earlier stage. Polyps are benign growths and lining of the bowel wall. They can be big or small, they can be single or multiple. They are commonly found during a colonoscopy undertaken via the bowel cancer screening programme because they are commonly found in the population and become increasingly common with age. We find polyps in half of patients who attend for bowel screening colonoscopy. What we know about polyps and cancer is that all bowel cancer starts off as polyps. However, polyps are common and most will never become bowel cancer. We cannot tell which ones will go on to become cancerous, so standard practice is to remove any that we see. And in most cases this can be done straightforwardly during the test without taking up much extra time. Occasionally we find big or complex polyps which can still be removed but might require you to return for a second appointment. For most people, having a colonoscopy is not particularly painful. It can be a little uncomfortable at times due to the pressure of the scope in the bowel wall, and you can sometimes feel a little bloated due to the gas that is put in. Many people notice very little discomfort, however, and improvements in technology and in training means that it's usually much better tolerated than it may have been in the past. You will be awake during the procedure. A reason for this is that you'll be asked to change position a few times during it in order to pass the scope more easily around the bowel and to see all areas of the bowel more thoroughly. You'll be offered medication that is quite effective in reducing discomfort without making you too sleepy. Yes, it's important to follow the instructions given to you ahead of your appointment, as your bowel needs to be clear. Otherwise, we might not be able to see properly inside your bowel, and it either won't take place or will need aborted. You will need to eat a low-fibre diet for a few days leading up to your appointment, and the information you're provided with will advise you regarding this. And then you'll need to stop eating solid foods before taking the laxative. The laxative, or bowel cleanser, is a powder that you mix with water. This will come with instructions. Once you drink the laxative, it will usually take effect after a few hours. It's important you are somewhere that you feel comfortable, as you will need to go repeatedly to the toilet. Yes, it's recommended that you take the day off work before your colonoscopy, as you'll need to prepare for your appointment. This will involve taking a laxative or bowel cleanser, which means you will have to go to the toilet repeatedly. On the day of your appointment, the colonoscopy itself will only take around 40 minutes. However, you may be in the hospital or clinic for a morning or afternoon, especially if you choose to have sedation. After the procedure, you may need some recovery time too. We understand that getting a colonoscopy will impact your usual routine, but it's important that you attend. If your appointment isn't suitable and you need to change this to work around your availability, then phone the number in your appointment letter and it can be rearranged.